Today I'm introducing a new product called Latisse, L-A-T-I-S-S-E. It's a product that's manufactured by Allergan, the manufacturers of BOTOX. Latisse is a product designed to help lengthen and grow your eyelashes to a more full effect, so it's more aesthetically pleasing. It's a product that's based on another product that's a prescription as well called LUMAGEN. LUMAGEN is designed to treat glaucoma, and what they found was patients that had glaucoma or increased intraocular pressure in the eye, that they were growing their eyelashes. So this is about a 5% of what LUMAGEN is, and it's intended specifically for aesthetic purposes to make your eyelashes thicker, grow longer, and appear darker. In a study of about 278 individuals, they found that about a 4% incidence of what they call adverse effects, or things, side effects, if you will, to put it in lay terms. And that included some darkening of the upper eyelid skin, and it's extremely rare, as I mentioned. And it's also something that is reversible if you stop the product, as far as I know. Also, there was some incidence of some redness of the eye that was also temporary in nature, but a very small percentage, as I mentioned. In terms of some of the things that have been known side effects of LUMAGEN, which is darkening of the actual iris, that was not found in the study. So this prescription in about 3 states in the United States, including the state of Texas where I practice, is a prescription product. You cannot get this over the counter here. It is carried in most of the major pharmacies such as CVS and Walgreens, etc., or should be. It costs us about $100 to $120 on average at the pharmacies. You must get a prescription here in the state of Texas. It is something that will last you probably about 60 days. So what do you need to know about how to apply Latisse? Basically, it comes in a little dropper full, and you actually take a little applicator, a brush. You drop a drop onto the brush, and you gently brush it over on one eyelash, and then you take the other dropper and you put another drop and put the application onto the other eyelash. There's a drop on each side before you go to sleep at night. A couple of things to keep in mind. If you have a conjunctivitis or an infection, it's something that would be a contraindication. In other words, you should not apply Latisse that night if you have that going on at that time. Also, it's a good idea before you start, before you apply it, go and take your contacts out, wipe your face, take all the makeup off, and really would be the last step before you go to sleep. You just apply it at night. The FDA does suggest that you should use a separate applicator for each drop. In other words, you put a drop onto the applicator, apply it here, take a separate applicator, put a drop onto that one, apply the other side. I think in general, you probably can go ahead and just use one applicator for both sides, but you have to put a drop onto each side. The only contraindication, in other words, something that would be against medical advice is if you had problems with intraocular pressure, things that were a little bit too high or too low in your intraocular pressure. Again, that's something that you have to check with your doctor if you've got eye issues, and you need to know that before you start. Obviously, if you have glaucoma and you're getting treated already with LUMAGEN, you should already see some of the side effects of growth for your eyelashes, so it's probably not necessary. And obviously if you're pregnant. But the main thing to understand is that this is a prescription product. You must speak with your physician. I'm not here to dispense medical advice. These are just general parameters that I've learned that I just want to share with you as a patient. So the bottle, as I said, will last you about 2 months on average. It is something that costs about $120, and for the effects, it takes about 4 to 8 weeks to actually start seeing the effects. And some of the studies have shown about a 78% improvement in 3 parameters, which is the actual thickening, which is the principal parameter of the eyelash, some lengthening of the eyelash, as well as some darkening of the eyelash. The studies that showed that growth percentage took about 4 months or so, 16 weeks before they actually saw that change. But as I said, the initial changes can usually be apparent somewhere about 4 to 8 weeks following onset of treatment. We do offer it here in my clinic/spa, and I have a phone number attached here if you're interested in contacting me if you're in the state of Texas and want to come in and learn more about this product. So hopefully that was a good introduction to Latisse, and I look forward to seeing you.